Tonight, COVID cases have soared past 100. 8 new ones being confirmed on Wednesday, with spread to Soufrière. Health officials say the respiratory hospital is not yet in danger of surpassing its capacity to manage COVID cases. And a GIS employee threatens legal action after being hauled in by police as a suspect in the recent GIS security breach. The details of these stories and more are coming up.
This is the Hot 7 Nightly News with Lovelace and Amy Joseph.
Good night. It is Wednesday, the 4th of November, 2020. Welcome to the Hot 7 TV Nightly News. I'm Lovely St. Amy Joseph. Thank you for joining us. The total number of COVID cases recorded on island is now past 100. 105 to be exact. Active COVID cases in country now stand at 73. It is a stark difference from the first wave of the new coronavirus back in March. The so-called second wave of the virus seems poised to sweep the various districts across the island if decisive action is not taken to curtail its spread. On Wednesday, Soufrière recorded its first case. St. Lucia's current COVID-19 toll is at 105 in general and 73 active in-country cases. 8 new cases were confirmed on Wednesday. The steady stream of confirmations continues to raise concern about adherence to infection prevention and control measures as the virus widens its reach to various districts on island. Among Wednesday's 8 cases was the first case from Soufrière. Chief Medical Officer Dr. Sharon Belmar-George gave the rundown of the new cases.
Case number 98 is a 33-year-old female from the Micoud district. Case number 99 is a 36-year-old female from the Soufrière district. Case number 100 is a 45-year-old male from the Babonneau district. Case number 101 is a 4-year-old female from the Vieux Fort district. Case number 102 is a 4-year-old female from the Vieux Fort district. Case number 103 is a 54-year-old female from the Labrie district. Case number 104 is a 55-year-old female from the Labrie district. Case number 105 is a 50-year-old male from the Gros-Islet district.
All of the cases following testing for COVID-19 were placed in quarantine to await their results. 4 of these cases were identified through the contact tracing process, and epidemiological links have been established for 3 cases.
Case number 103 and 104 were identified through the community outreach activity undertaken in Labrie. As per protocol, arrangements have been made for the transfer of these individuals into care at the respiratory hospital. All of those cases remain stable and there is no case requiring critical care. As we continue to record new cases of COVID-19 in country, it is important that we all make a special effort to keep ourselves well. Be sure to eat a balanced meal which are low in salt, fat, and added sugars. Make time for physical activity daily.
The CMO stresses that these daily habits will help build the body's ability to fight off infectious illnesses. Members of the public should also continue to practice the guidelines to reduce the exposure to the virus. Wash hands frequently or use hand sanitizer. Wear a face mask. Maintain a separation of 6 feet from others, which is about 2 arms length apart. With the continuous rise in cases of COVID-19 here on island, the St. Lucian populace has raised concerns over the capacity of the island's lone respiratory hospital. At a press conference on Wednesday, officials of the Ministry of Health and Wellness sought to allay the fears of residents and to assure all that if push comes to shove, an alternate plan is in place. Nisha Charles tells us more.
As of Wednesday, November 4th, 2020, the number of active COVID-19 cases in St. Lucia stood at 73. At present, the respiratory hospital is operating at 2/3 capacity with 82 beds. At full capacity, the institution holds 126 beds. But what happens when the facility reaches full capacity? Permanent Secretary Benson Emil responded by saying that the ministry has it covered if and when that occurs.
As we continue to experience this pocket of spread, we are of the view that if we have the hospital operating at full capacity, we will be able to receive, and sustain that effort. But if we had to move, in another phase of progression of the disease where you have, a general outbreak, and that is not what we're looking forward to, but our admission policy at the hospital would have to change. At present, what we have is every positive patient, being admitted at the hospital. But if we have to move to that phase, we will have to consider, the hospital only admitting persons who require, care as a result of the complications of the disease.
Presently, the respiratory hospital caters to anyone who is suspected of having respiratory illness. Those who are admitted are either suspected or confirmed of having COVID-19. For asymptoms, Emil says they will be isolated at home when the hospital reaches full capacity.
The policy of the ministry is if you're displaying, symptoms associated with, respiratory disease, you have to call in to one of our respiratory facilities, the respiratory hospital being one of them. You'll be assessed and tested for COVID, and at that point you will be categorized, as a suspect case. So we have positive cases, and we also have suspect cases at the respiratory hospital. There's persons who have been tested and we have not received the results. And we have a few patients who are negative, but because of, the other complications or comorbidities, they, in transit to OKUH.
On Wednesday, the island recorded another 8 cases of COVID-19, taking the total count to 105. For the Hot 7 News, Nisha Charles reported.
The GIS-NTN security breach has taken a stunning turn as a young man, an employee of the entity, was hauled to the Criminal Investigation Department on Tuesday. The employee was questioned as a suspect in the matter, and a search warrant was executed at his apartment. In a subsequent interview with online agency Loop News, the young man indicated that he would seek legal advice and intervention. He proclaimed his innocence and threatened legal action in the matter. In his interview, he indicated that he was informed by police that their incriminating evidence consisted of a WhatsApp status where he complained about work. The other was the fact that he had been jogging around 5:30 p.m. on the 28th of October, and the destruction of GIS-NTN equipment is believed to have happened sometime between the night of Wednesday, the 28th of October, and the morning of Thursday, the 29th of October. Principal Information Officer of the GIS, Davina Lee, informed the nation of the breach on Thursday, the 29th of October.
Hard drives containing approximately 120 terabytes of data, which included valuable historical footage of national importance, was purposely destroyed, as those drives were dismantled and a substance poured over them. Technical editing bays at the GIS were also ransacked, and a DVR machine containing surveillance footage is currently missing. This matter is now in the hands of the Criminal Investigations Department of the Royal St. Lucia Police Force and is under active investigation.
The employee, who was taken to the CID for questioning, declined to comment further on the matter, but says law enforcement will be hearing from his attorney. Stay with us. Still to come, Gros Islet minibus owners and city police team up to ensure that drivers and passengers adhere to COVID-19 protocols. Earl Booski says a Biden or Trump victory will not make a dent in America's affairs in the Caribbean region. And the U.S. election continues to spark intrigue as Donald Trump declares victory for himself and makes claims of election fraud. That and more coming up after the break.